Health and well-being are constant parts of every single person's life. From weight and blood sugar to more complex illnesses like cancer, we all have a level of responsibility over our own health. In more recent years, the health of the UK public has been put to test, with an obesity crisis across all ages, COVID-19 pandemic, and an ageing population. Equally, with the stresses that the NHS is suffering, the levels of quality of life are declining for many people. And with GPs so busy, it's difficult to seek a solution that involves large-scale medical professional support. Core to this crisis is the low levels of health literacy. This causes the public to be complacent with their health and often shifts the responsibility over to medical professionals, which leads to further waiting times and financial issues for the organisation that is already almost at capacity. With this in mind, the goal of my FMP is to generate a solution that will help the UK public take control and responsibility of their own health, while improving the connection between the doctor and the patient. In 2020, the NHS noticed a 23% increase in admissions compared to 2017, where obesity was a key part of the condition. Between 2019 and 2020, more than 100,000 people were diagnosed with diabetes. In 2020, 317,000 cases of COVID-19 were diagnosed. Again in 2020, 1 in 6 people are over 65, and that is predicted to rise to 1 in 4 by 2050. In all these cases, the NHS is our front line, but does it have to be? Or could we, as a society, change our behaviour to not only lessen the impact, but also save lives both of others and of our own? The UK is suffering health crises left and right, while demands on the NHS are getting worse and worse. In order to secure a future for the NHS and to improve the quality of life, something must change. Part of the health issue is a low standard of health literacy. The public hears so much information, but it either doesn't understand it or doesn't understand the urgency for it. And with it only being taught in small cases every now and again within schools, colleges and universities, the UK is sleepwalking down a path that will only make the issue worse. To turn this around, tracking health not only needs to become important again, but also convenient and supportive. With so many apps existing to track activity and diet as separate entities, it is a flooded market, but none really have health literacy as a goal, nor do any of them support the GP to patient relationship. This will form the USP for my FMP and what will set it apart from all the other competitors. Welcome to Health Hub, my potential solution to the ongoing long-term health crisis within Britain. An accessible and medically backed app that allows for live tracking of health variables while providing a record of existing conditions, including simple and easy to understand explanations of what it all means. Within the homepage, the user will be able to see a brief glimpse of how their health is faring over an average time period given as a health score. One element that is great for long-term health issues is the medication reminder shown in the top left. This reminder would also incorporate a push notification through the phone OS and will not only remind the user to take medication, but also when to order a new prescription, potentially helping the elderly and those with multiple medications. Using the framework set by the NHS, the inbuilt symptom tracker will allow the user to write to their health profile in a guided way. This will avoid a level of hypochondria while maintaining health support through the app. With COVID-19 being prevalent in today's society, this section of the app is key as it will allow GPs to be aware of who may have symptoms and will also help track and trace systems implemented by the government. Privacy of health is always an important issue when dealing with large numbers of patients, so with Health Hub, the user's health profile is stored within a locked section. Access to this profile can only be accessed if the user creates a randomly generated key. This then becomes the password for the GP to access the health profile. This will still allow for remote access, which, with the growing number of phone and Skype GP appointments, is paramount to maintaining the user's health and medical support. A quick add system, access to swiping to one side, will allow the user to quickly input data without having to find their way to the health profile. Customizable in the settings menu, any aspect of the user's profile can be inputted, including sections added by the user's GP, like blood pressure or blood sugar. The centerpiece for the Health Hub app. The health profile section is where the user will be able to see live infographics of the health stats that form their health score. At a glance, the user will be able to see the latest data points, which will be color-coded to show good or even bad health. When the section is pressed, the user will have a more in-depth analysis of their health data, including a goal tracker and an encouraging summary of how they are doing with the long-term picture. One of the core goals behind Health Hub is to improve the patient's connection to their whole health. By being able to track their own conditions and by providing a breakdown of the conditions at hand, Health Hub can improve the health literacy of patients. As the patient is diagnosed with a condition or ailment, the GP will assign the condition tag to their profile. From here, the patient will have a full list of current conditions in severity order. Knowing the name of the condition is only half the battle for patients. So with Health Hub, each condition is expandable through the current condition tab. This expansion is split into two sections. Firstly, the condition tab explains the condition both in text and in video format. Secondly is the treatment section. In this section, the breakdown of the treatment plan is made clear, including what medication may be prescribed and even what the patient is meant to do. For instance, book a scan or contact a specialist within a certain time. Key to the expert's advertising is the startling statistic behind the need for health literacy. This shocking headline will push the urgency of getting patients using Health Hub further. The tone of voice within the body copy uses an emotive and empathetic push to encourage the GP to help their patient's health. Working from a lifestyle theme, the patient advertising focuses on empowering the patient to take control of their own health. By showing the app in context, the app gains a level of credibility as it demonstrates the app in a relatable scene. The sports earphones, although subtle, do provide a sense that the app encourages activity and wellness. Using a new app can be daunting for some people, such as the elderly. A handy leave piece that GPs will be able to leave with the patient, plus visiting nurses could leave them with home visits. This leave piece breaks down the usage of the app and explains the sections using the icons that appear within the app, helping users find their way through the app even quicker. Health Hub's social media presence will only have one goal in its use, and that is to inform users of health information. Even basic health literacy like daily calorie intake can be forgotten or even totally ignored. So having an active social channel will encourage audiences to maintain good health habits. In addition to this, the social channel can provide health updates or even medical advice, such as what conditions can be treated with paracetamol. With health literacy being a continuing problem and with COVID-19 in play, Health Hub has an important place to fill. And by designing and simplifying each step to the app, it becomes more user-friendly all the time. And by adding customizability and personal touches, it cements itself in the user's everyday life.